About 3 years ago, we became able to freeze eggs by a quick freezing process called vitrification. And it's basically a flash freeze. The tissue is directly placed in liquid nitrogen, so it's very quickly frozen. And we've now discovered that quick freezing technology has dramatically improved the survival of eggs and embryos. It has not yet been used with sperm.
We use egg freezing for fertility preservation. Sometimes that's a woman who's undergoing cancer therapy and wants to preserve eggs for future use that might have been destroyed otherwise by her chemotherapy regimen. Maybe a woman who's had some surgery on her ovaries and she's concerned she's going to be getting kind of low in eggs if she doesn't try and save some right now. And then the third reason, we call it social fertility preservation. They're at a point maybe in their early to mid-30s when they aren't ready to have children yet, but they're concerned that if they wait until they are ready to try and have children, their egg quality and number may not be adequate to allow them to have children. So we can freeze eggs or preserve them for the future. This seems to work best if the woman does this by the time she's in her mid-30s. Whatever the reason is that she's trying to preserve her fertility, she has to undergo stimulation of her ovaries to produce as many eggs as possible from the group for that cycle. Then we have to retrieve them, which is a standard egg retrieval. The woman is put to sleep, we collect the eggs, and then we take them to the lab, at which time they are then freeze-dried and saved for future use.